Now let's decipher the coding of this excision. Coming to excision, we need to know what is the nature of the tissue that we are excising. Is it the benign lesion or the malignant? So hope you will have a clear understanding of what is a malignant lesion. A malignant lesion is capable of metastasis, where the disease spreads from one side to the other. It is a cancerous condition, that is a malignant condition, malignancy. So the patient has systemic disorders where then they'll have to subject to other treatment like radiotherapy, etc. and all that. Here let us limit. So you need to know whether what is the type of the lesion. Is it of benign, meaning that there is not much harm, or is it cancerous one? Because we have conditions like basal cell carcinoma, squamous cell carcinoma, malignant melanoma. These are all cancerous conditions which fall within the malignancy code. So now let's restrict our topic to the benign code, because the same classification follows for the malignancy as well. If you know how to decipher the code, figure out the code for this benign lesions, then it is the same for the malignant as well. Okay. Now let's see a case where the patient comes for the removal of a benign lesion which is of 2 cm. The coding would be 11402. And if it is of malignant, 11602. And another tip which I want to mention is, if it is ending with 2, it will end with 2. If it is for a 3 cm, it will become 11403. If it is for a 1 cm, it is 11401. This way you can understand. And next thing, you need to know whether it is trunk, arms or legs. Okay. So very simple. So you will have to code separately for each of the lesion that is being excised by the